Okay.
All set?
We're live.
All right, good evening, everyone. This is Dr. Schilling bringing this week's Wednesday Wellness Minutes, and this week, Anissa titled it, Love Your Girls. And you probably know what that is. October is Breast Cancer Awareness Month, so ordained by someone somewhere, probably the Breast Cancer Awareness Foundation or something like that. So this is a complex issue that we're going to try and give you some concise information about that you're not going to hear from your medical doctor. And that's, of course, what we try to bring you, information that you're not going to hear anywhere else, so it can change your life and change the life of someone you love. This is a pretty big issue for a lot of women. I think it's the most feared thing that women deal with, or at least one of them as far as health conditions. But about 1 in 8 women will develop breast cancer in their lifetime. And what you'll find out in a minute here has really little to do with your genes. Your DNA is not your destiny. It really has more to do about your epigenes, which is your lifestyle and things like that. So 268,000 or some odd new cases of invasive breast cancer are going to be diagnosed or have been diagnosed, at least prospectively, this year. And that's actually decreasing over time. So the number of invasive cancers that are diagnosed in men is only about like 3,000. So 270, 3,000, pretty dramatic. But men and women have different tissues. Like men still have glandular tissue in their breast, but women have much more, and it produces more hormones than men's do, based on hormones and things like that. But from 2000 to 2003 even, it already dropped something like 7% as far as the incidence of breast cancer. And so what you want to appreciate is that even though we're not quote-unquote winning the battle against cancer, people are becoming more aware of it. A lot of that has to do with decreasing hormone replacement therapy. That was a big rage for a while, like, oh, you're in menopause, you don't have any hormones anymore, your uterus and your ovaries are sputtering to create the hormones, so we're going to give you some hormone therapy. And what they found out from the Women's Initiative study, I think it was in 2002, they found out that it was finding hormone replacement therapy was creating more cancers than was helping. So a bit of a problem there. So your lifetime risk does not necessarily depend on a firstborn or a first relative having cancer. It will increase somewhat, but it doesn't necessarily guarantee you have one. So don't be worried about family members that have cancer or have developed something like that. I like to nickname it Dancer, and I got that from one of our participants that came in, because the word cancer just strikes fear in people. So we tend to refer to it as Dancer or some other, we call it an invasive species of some sort, like Asian carp or something, like, a little different, Asian carp for your body. So something that's attacking your body and affecting it. So this is a scary thing, depending on your race, your gender. Obviously men get it much less than women, but as far as African Americans are less prone than Caucasians and Asians and things like that. It just depends on your ethnicity. So, but your risk, even though it's not your DNA is not your destiny, will double if a first relative has had it. So just understand that we all have a genome which has things like switches, and what happens in your lifetime can switch something on or off. That's where people typically talk about the BRCA1 and BRCA2 genes. You got Angelina Jolie of Brangelina, the famous one, who prophylactically, she thought, I'll preventatively get a bilateral mastectomy. So she had both of her breasts removed in prevention of the actual fear of the cancer developing, because she didn't want to have to deal with it. That's a pretty aggressive thing. Only 5 to 10% of cancers are developed as a result of the BRCA1, BRCA2. So you want to appreciate that just because you have a gene does not mean it's turned on. Okay, we all have tons of genes, and if you don't have the stress or the toxins or the injuries in your lifetime to turn on that gene, you don't have to worry about it. So don't go freaking out if you get a 23andMe or some other, Ancestry.com, you get a BRCA gene on there. I don't know if they have them in there, but don't be worried, okay? It's not a guarantee. So your risk of the issue of breast cancer as it relates to BRCA1, BRCA2, much less than people might appreciate. And as a result, you always want to take caution. So take the information and gather more information and figure out what you need to do for yourself. BRCA1 and BRCA2 are much less common in men, and their incidence as far as their issues with men are a lot less. 85% of cancers that affect women have no family history. Okay, so if you have a family member, it's no guarantee. And even if there is 85% of the people that have had breast cancer, they have no family history. Okay, so don't let your family's history dictate your mentality about what's going to happen with your health. It's a really important thing. typically if you get a diagnosis, something like this, you should either accept it and roll over and give up, or get pissed off and change your lifestyle and change your habits and change your relationships and things like that so you can change your life. Genetic mutations, they just play such a small role in this whole thing. It's such a small risk factor. But the biggest risk factors for cancer, breast cancer specifically, is your gender, which is female, and your age. As you age, you carry on more toxic chemicals and things in the environment, and your risk increases. We also want to understand that the medical theory for cancer is it's an abnormal gene, which we just proved is not relevant because 85% of people have no family history that get cancer. So it also, not only can medical science not determine the theory based on genes, it also can't tell you why. Is it a ductal breast cancer, or is it a glandular? Okay, there's two different types. And what we're talking about is the different parts of the brain control different parts of your body. Okay, so the cerebellum on the left will dictate an issue on the left or the right, depending on your gender and your person's role in your life, which we'll talk a little bit more about it. Mammograms, if you've ever heard of them, which most every woman has, because you go at this point in your life and you get a mammogram, and basically what they do is they put your breast in a machine and they squish it down, and they basically take an x-ray of it. And that is putting ionizing radiation into the breast tissue, which can accumulate over time and cause cancer in and of itself, which is not, of course, what you want. Our recommendation is that you work with a local practitioner, and we have a reference for that if you're interested in one, for thermography, which is the thermograph and looking for heat signatures and increased metabolism in the tissue. So you do a thermographic scan of the chest area, and let's say most everything is cool because it's fat tissue is typically cooler, more insulating. If there's a bright spot, it would indicate some type of increased metabolic activity, and you'd say, well, that's interesting, we should probably check that out. So then you take the thermography and use that for greater diagnostic testing. Regular self-exams are great. Concentric circles, so working from superficial to deeper in concentric circles. And just, Vanessa said, love your girls, you got to know your girls too. Okay, so you have to be familiar with how they feel and whether there's fibrocystic stuff in there, like little nodules and stuff like that. You want to look for non-tender, non-mobile, and you can't get around. So you want something, if you find something that feels abnormal, you want to know, is it tender? Is it mobile? Okay, and can I get my fingers around the margin? Okay, so that will tell you if it's a lipoma versus a carcinoma. So carcinoma typically refers to carcinogen, cancer, things like that. A lipoma can be a fatty cyst in there. So if it's tender, it's most likely not cancer. Most likely. There's no hard and fast rule. And even if it was, you don't know if it's in the healing phase or the active conflict phase or the healing phase, because there's two phases to this whole process. So what you want to understand is that when there is issues in the milk duct, it's different than the glandular. Okay, so we need to understand what part of the breast is being affected and then become more empowered as a result of that. A big issue with any issue in our body, any issue in the tissue, is a self-devaluation conflict. And that can develop prior to having some type of issue like this, or it can develop as a result. If a person gets a cancer diagnosis or they have to have a mastectomy or something like that, they can get a self-devaluation conflict, which can further develop into other challenges because that's another conflict in the brain. And so when you think about it, tumors can be interpreted as something defective about you. Okay, oh my gosh, there's a tumor, there's something wrong with me, which can further your problem and create greater problems for you. But understanding that a lot of things can cause things to build up in the breast tissue. It could be after lactating. It can be calcifications. It could be excess calcium that's brought on from the bone to use somewhere in your body and can end up lodging itself in the breast tissue and be seen on a mammogram or some other thing like that shows like crystals in there. And they say, oh, because medical science will say that type of thing is actually a precancerous indicator. And so you want to be careful that you know what it is before you start getting biopsies and creating scar tissue and having mammograms and things like that. So there's just a lot of nuances to this, and you always want to be very careful with how you're approaching this because it's not cut and dry. It's not simple. Some things to remember and even consider. Removing the breast does not guarantee that you will not develop a cancer. Okay? Just because you cut the tissue off doesn't mean that it couldn't be somewhere else or that that's even the problem. Remember, All cancers start in the brain. Doesn't matter if it's prostate, lung, liver, breast, colon, doesn't matter. It always starts in the brain because the conflict happens in the brain and then the stress shows up in the tissue. And if it's there prolonged enough, then the tissue becomes dense, hard, cordoned off from the rest of the body and things like that. So always look to the brain first. So cutting off doesn't guarantee anything. We talked about the ionizing radiation from the mammography, the mammogram. Physical examinations are fantastic. We talked about that. If you have PCOS, polycystic ovarian syndrome, or polycystic breast tissue, or fibrotic breast, typically we think of the PCOS and the polycystic breast as blood sugar dysregulation and hormonal issues, because when your blood sugar is all out of whack, your androgens go up, which is your male sex hormones, and then that can create different tissues in our glands, in our breasts and things like that. So you want to understand that it's really important to understand, like if your blood sugar is out of whack, a lot of things can happen in your ovaries and your uterus and your breasts that can look and scare you like it might be cancer. So always understand that you got to dig deeper than that. It's not just a knee-jerk reaction to say, oh, I got cancer. Always be aware of that. Milk ducts can have an infection. For any woman who's ever nursed, you can get mastitis, you can get an infection in one of the milk ducts. You have to either have trouble expressing or things like that. We recommend Medibody packs, like actually putting healing mud over that tissue to draw the toxins and relieve the stress, the blockages. If you have liver stress, if you have a virus or some other issue in the liver that's causing lack of lymphatic drainage, you have a lot of lymphatic tissue in the breast. As a result, that can back up and fluid can, it's like an exudate is a fancy word for like a lot of fluid building up in there. And that can feel abnormal, especially if it's in a small pocket. You want to consider that. Estrogen toxicity. Estrogens are everywhere. Plastics are a big culprit for that. Beauty products, lotions, anything with perfumes in it has a lot of xenoestrogens. And there are a lot of breast issues and or polycystic ovarian syndrome and stuff like that is related to excess estrogens. Endometriosis, endometritis, and things like that. So don't ever discount that. When anyone talks about cancer, you always want to take a step back and say, look for the infection, because all cancers are and ultimately a chronic infection of some sort. And because the disconnect between the brain and the body and the conflict that goes unresolved, the immune system gets out of whack, and then our microbiome gets all screwed up, and it can be a parasite, bacteria, mold, fungus, or virus, anything like that. Another term you want to consider are called biofilms. Biofilms are like the thickness of a hair, but it's like a mucous membrane that different microorganisms hide under, like these little colonies. They're called biofilms. But they can be in your bladder, they can be in the breast, in the nose, in the lungs, and things like that. And these things can hide under there. And as a result, your immune system cannot address them appropriately. So you want to always understand using things like enzymes and things like that to break down the biofilms is really helpful for preventing things. Free radicals. So whether you're talking about excess sun radiation, ionizing radiation from an X-ray or a mammogram or things like that, it creates free radicals. And I think of it as the Tasmanian devil. If you've ever seen the cartoon The Tasmanian Devil, it's this short little stocky dude, fuzzy little thing, and he whips around in circles, and it's basically like a bull in a china shop. That's what I envision when I think of a free radical. It's just in there just wreaking havoc all over the place until something comes in and quenches it, like calms it down, like soothes it. So you want to use antioxidants and things like that to quench your free radicals, because infections create a lot of free radicals. Infections also create a lot of neurotransmitters, so GABA, glutamate, things like that. Typically not GABA, but more glutamate, highly reactive neurotransmitters, which can then super excite a cell. Like too many neurotransmitters can excite a cell, overexcite it, and excite it to death. Like literally just overdrive it until it dies. And then that can create some death in the body, and then your body has to clean that out. And if it's not able to clean that out, then that becomes a problem. So things to consider: liver toxicity, liver immune system, things like that, lymphatic drainage, inability to get things out of your system, conflicts in your life, relationship conflicts. We'll talk a little bit about previous years of cigarette smoking and needing to get the antioxidants in so you can get the free radicals out and neurotransmitters calm down. Stop using antiperspirants and things like that with aluminum in it that are packing your pores, that are going to end up getting sucked into your lymphatic ducts and then blocking your perspiration, because that's a mechanism of breathing toxins out. Really important you consider doing something else like that. If you have an odor that you're not liking, it's probably coming from your liver and or your gut or both. You can put Medibody packs in your armpits and clean those out. Not a bad idea for anyone who's ever used an antiperspirant or deodorant. One really important thing is if you can avoid wearing underwear or bra, always do that. If you can get a sports bra that has no underwire, you don't want a lot of compression underneath the breast tissue. I can't speak from personal experience, but what I do know is that these are very common, like underwire bras, lifting bras and things like that, but they put a lot of pressure, okay? So you need to respect your body and understand that it needs help, but and support, if you will, but it can't be restricting or suffocating, if you will. Look for toxic teeth. Teeth can reflect anywhere in the body. We've talked about toxic teeth in the past, but teeth can reflect from the liver, they can reflect from the colon. We find teeth all the time. They can come from the stomach, the large intestine. It can come from anywhere. You never know, the pancreas even. So always inspect teeth. Look for root canal teeth, abscess teeth, things like that. It's really important because they can reflex up to the down to the breast and or anything like that. Monitor your pH, your potential hydrogen is what it's called. That's really about, you want your first morning urine to be between 6.0 and 6.4 and 7.0, pardon me. That's really an indication of your acidity level, and you want to monitor that closely if you're concerned of cancer in any way, shape, or form. But it's just generally good to get some urine or some saliva strips and monitor your pH. It's really important. Interference fields are what we talk about, injuries, C-section scars, appendectomies, laparoscopic issues where they go in for your gallbladder, they go in through your belly button. It can be injuries from an old trauma. You can have a slip and fall on your tailbone. It can be a hit to your head. You can break your clavicle, injure your ribs, especially near the breast if you have an impact, like a seatbelt coming across from a car accident and things like that. You can hit your chin. You can injure your ear. These things can reflex from anywhere. And oddly enough, it's like this can injure this down here, which then reflects back up to here. So our job is to find that for you. We're the detectives. We'll help you get that information. But it's important you investigate all these. But we use Medibody packs to help restore the issue. But if you ever get a mastitis or an infection in the breast or even cancer in the breast, you want to put the healing Medibody pack over that, and we can give you instructions on that. Some of the supplements you can use: isoflavones, green teas, turmerics, your omega-3 fatty acids. You can use an HCl detox kit to flush out infections. There's like propolis and things like that. There's all kinds of fun stuff you can use to support your system and get the toxins out if you need to. A couple lab tests I want to bring to your attention. Lipid peroxidase test rather. This is really helpful to figure out what the metabolism is like going on in the body, and so it's done on empty stomach after exercise, and it actually determines your body's ability to detox. So lipid peroxidase test. And there's also the anti-malignant antibody screen. So the AMAS, and you can go to oncolabinc.com. So it's a free kit that you have to pay them like $250 to get it processed, or you can have your medical doctor write a prescription for it. In fact, I think you have to have a physician's recommendation to get it. But go to your medical doctor and say, hey, I really want to get this, the AMAS, the anti-malignant antibody screen. It can help you avoid the invasive the lumpectomies and things like that, and any adverse reactions to that. So lipid peroxidase test and the anti-malignant antibody screen is really helpful. Now, as we mentioned earlier, the conflict with cancer always starts in the brain and it shows up in the body. So emotional issues are the big problem. It's unresolved traumas, unresolved things like that. When we have people work with us, we test them against a couple of statements. One is, now I can be healthy, and the second one is, now I can do whatever it takes to be healthy. And 80% of people with cancer will fail that. Okay, 80% of people, I think, on average, will fail that. Now I can be healthy, now I can do whatever it takes to be healthy. As a result, if you fail either one of them, it means that your brain, your subconscious brain, not your conscious brain, your subconscious brain is committed to that path. Like, you can't be healthy, you can't do whatever it takes to be healthy, it's going to undermine your health. As a result, your body's going to oppose, potentially, any nutrition, helpful things you might do for it until you change how your brain functions. Okay, and that could be a limiting belief you picked up from your parents or inherited from somebody else and it got switched on in your lifetime. Really important to keep in mind. So let's talk about two major areas. We have glandular and we have ductal breast issues. So the glandular breast tissue is related to a nest worry. Now, nest is like, for a woman, it's like your nest. It's your home. It is your work. It's your friends, your family, people you care about. And so let's just say that a woman has a left glandular breast issue. Okay, and if it's the cerebellum, we're talking about where the nest issue is going to be. So if you have a right cerebellum issue, it's going to show up in the left breast. So if you have one on one side of your body, and it's a glandular tissue versus a ductal issue, you want to look for the sidedness. Okay, so in the cerebellum, you'd look to the right cerebellum for a left glandular tissue where that nest worry happens. And that's going to be feeling unbalanced, unsure, feeling victimized, oversensitive or unsafe about things. So it might be dwelling on a conflict or a problem you had in the past, being visibly worried or anxious. Those are kind of some things you might experience if you have this type of challenge. Someone who deals with strife. Strife is like the bitter disagreement over a fundamental issue. Like if you have a nest issue with a spouse or a partner and it's a bitter disagreement on a fundamental issue, that can develop a conflict that if unresolved, it can start causing serious problems. Besides the glandular, there's intraductal, so the ductwork of the breast, if you will. That's going to be the sensory lobe of the brain. So in that case, it would be the same side. So if it was a ductal issue on the left breast, you would expect the sensory lobe on that same side. Okay, so you don't need to worry about too much of this. Our job is to understand this and learn how to connect the brain and help you understand how we can resolve that by resolving the conflict. But the ductal issues are typically being abandoned, blamed, grief, hurt, some type of rejection, feeling resentful toward people or someone in your life. You can be feeling manipulated or controlled. But there's also the feeling like someone was torn from your breast, or there's a deep separation loss, like you did not want to separate from someone and it ended up causing a conflict that resulted in an issue in the tissue. It's a mouthful to say. But just remember the ductal issues are controlled by the sensory cortex in the brain. So there's two phases, conflict phase and the resolution phase or the healing phase. And depending on when you get your scan done, like a mammogram or something like that, you don't know which phase you're in. You don't know if your body is in the proliferation phase or the conflict phase, it's getting bigger, or if it's in the healing phase and it's starting to encapsulate and dissolve. It's really important to understand that there's two phases. So for example, a woman with a sensory conflict and it's a ductal issue, let's say that they're no longer nursing, they're no longer producing milk, but they happen to be, for example, walking along on the sidewalk and all of a sudden they have a young child that darts out between cars and let's just say, for example, hypothetically, they get hit by the car. This woman can go into a conflict phase where they have this nest worry and they start worrying about it, right? And they can start lactating as a result, even if they're not nursing. So it's amazing what the brain can do, because once that nest worry and because they want to nurse that child, they want to bring him back to health. So they start lactating as a result. And so I know of at least one, well, more than one participant we worked with in the past that had an issue of ongoing lactation, and then when we finally resolved the conflict, they stopped lactating. Okay. Now they had no idea what the conflict was. They needed help with that, and I couldn't tell you off the top of my head what it was. But finally, they come in and they say, "Yeah, this one, just thought it was fascinating," and it finally stopped having drainage or leakage or whatever it was. It's just fascinating stuff, and this is the kind of stuff we see every day. But tumors aren't necessarily a bad thing because your body's trying to heal it. It's trying to encapsulate it and ward it off from that. So every single type of cancer, if you will, every single disease starts with a shock, an unexpected shock that catches you off guard. And that example for the child and the mother would be a definite example of that. It could be a harsh remark. You could have failed an exam, but it's like, oh man, I thought I was doing great, and all of a sudden I failed that exam. Or, I was just, I know somebody from work and we normally get along just fine. All of a sudden they totally insulted me, and now I feel like I've just been tainted, or now I'm self-evaluating or something like that. So what you want to understand is that a disease starts in the psyche and in the tissue at the same time. Okay, because as we've shown a picture of the cortical homunculus in the past, the brain and the body are connected. As a result, it doesn't happen one or the other, it happens at the same time. It's a simultaneous thing. And so with the breast, the cancers are always related to arguments or worries or something like that. And so just understand that. So I just want to wrap this up as far as there's a lot of information. But one last thought I want you to consider about the diagnosis of cancer. You hear about people with with brain cancer, but brain cancers don't very often metastasize to the other parts of the body. Okay, you don't hear about a brain tumor. All of a sudden, I have this glioblastoma. Here's a fancy word, glioblastoma, and that you don't say, oh, the glioblastoma metastasized to the hip joint, right? They found cancer in the hip after it was a glioblastoma, or that came in the liver, the colon. But for whatever reason, when they find it in the tissue, they don't go to the brain to find the calcifications in the brain to the specific part of the brain. So if you ever have diagnosis of them, have them do a brain scan and see where they can find calcifications, because I can guarantee you there is a direct correlation between the tissue in your body and the brain scan. You just need to have someone who's willing to do the brain scan to help you understand. And you don't necessarily need to have that done, but it's certainly fascinating if you wanted to. This is all Dr. Hammer's work, Geerd Hammer, German New Medicine, the founder of all this information as far as the connection between the brain and the body, because he was helping people heal themselves of cancer without medicine. And German medical board didn't like that so much, so they took his license and tried to throw him in jail. He said, "That's all right. I think I like live outside of jail." So, fascinating story. If you ever want to look up German New Medicine, Dr. Hammer, it's fascinating. But you just don't have a brain tumor show up in the prostate. It's just random. So, a lot of information. Talk really fast. So, just take it in. If you have to rewind, back it up. Let us know what your questions are. Share your comments with us. Some people in the past have commented, like with the trigeminal neuralgia, they're like, "Well, I had a surgery on my jaw, and then I got trigeminal neuralgia. It can't be possibly a virus." Well, of course not. And you hear me say all the time, and we joked I'm going to tattoo it on my forehead. No one thing causes any one thing. I got Anissa just dying over here. She's like, "Oh God, here we go again." But no one thing causes any one thing. Okay, so there are a bunch of different factors that go into this. So understand that there's a bunch of stuff that came together and formed this problem, and there are answers to your questions. So just understand that if you need help finding those answers to that, don't give up. Someone out there is there to help you, and if you want to help us to help you, we're happy to do that. So help people that need help. Share this with your friends and family. People don't have this information. They don't understand it, and they're just afraid for their lives, and they think cancer is a death sentence. It doesn't have to be that way. Do everything you can to prevent it. Get aggressive if you get some type of notification like that, and just go full force. You gotta all guns blazing, right? Come out firing. You gotta get after it. You gotta do what you can, and we're here to help you. A lot of tools you can use. It just depends on what the right mix is for you. We are, of course, launching regenerative cellular therapy treatments in the clinic in the month of November. We're actually taking a trip. 3 people and myself, we're going down to Colombia the first week in November to experience intravenous stem cell therapy, regenerative cellular therapy. And basically, I'm going to get hooked up with a tube, and I'm coming out, I'm going to be glowing. I don't know what's going to happen. 110 million cells firing through my bloodstream into my body, helping me regenerate all the stuff that I don't even know is going wrong.
You talk even faster.
I might talk even faster than Nessa says. Let's hope not. But we want to make sure you know that we'll be doing biofacials and regenerative cellular therapy for the joints and things like that, PRP injections, stuff like that to help your body heal faster. So even if you have a tear in a ligament, a tendon like that, you don't have to have a joint that's breaking down, but you could have a massive muscle strain sprain with ligamentous tears and stuff like that. You can do PRP and regenerative cellular therapy for that as well. And if you want to look younger, you can do a facial as well. And for those of you who don't have concrete for a scalp now, like I do, and want hair regeneration, you can do that too. So just to let you know it's a possibility. It doesn't have to be, the rest of your life to deal with that. Catch it early, you can save it. Some of us don't have that luxury anymore. So don't let stress get the best of you. Resolve your conflicts.
You want to plug the thermography event?
Yeah, absolutely. When is it?
Tuesday at 6:30.
Tuesday at 6:30. There's going to be a thermography event.
River Falls.
Call us for information or comment below.
Thermography of Wisconsin.
All right, there you go. Thermography of Wisconsin. Anissa's all over it. We got a flyer here at the clinic. It's great. People are excited about it. Get informed. Get educated. Know the difference between mammography, thermography, and the risks and benefits for you of both. Any more these days, you can't trust everything that's in the news. In fact, don't trust anything for that matter. Be a skeptic. Get the information. Dig in. Figure out for yourself. So next week we're going to be talking about gut health. Gut health is the most important thing for your immune system, really, because 70 to 80% of your immune system lives in your gut, and just as many messages go from your gut to your brain as your brain to your gut. So we'll be talking about that next week. All right, guys? Hope you're doing well. Take good care. We'll see you next week. Bye-bye.